Welcome, and thank you for taking a few minutes for this training. This module will introduce you to the LAXO device and how we'll be using it in clinical practice here on Francis 4C and Mary Bryce 7B. The LAXO study is led by Rob Hill and Michael Thorne, both nurse practitioners here at Mayo Clinic. As a bedside nurse, you are at the center of this study, and this presentation will cover everything you need to know. Let's start with the why. Jackson Pratt drains do important work after surgery. They remove fluid that would otherwise collect and cause problems. But when drain tubing clogs, drainage fails. That can mean seromas, hematomas, infection, trips to interventional radiology, or even a return to the operating room. Today, we manage these drains by manually milking or stripping the tubing, by hand, or with whatever tool is around. The technique varies from nurse to nurse, and the results vary too. There has never been a standardized, purpose-built tool for this everyday task. That's the gap the LAXO device, and this study, were designed to close. So what is the LAXO? It's a small, hinged, handheld device that closes around drain tubing and applies circumferential compression, meaning it squeezes the tubing evenly, all the way around, fully compressing the lumen so intraluminal contents move down toward the collection bulb. Its design accommodates multiple drain sizes, flat or round. It gives every nurse the same standardized technique, with less hand force than manual stripping. This device is single patient use only. It stays with one patient, cleaned with an alcohol swab between uses, and is never shared. Here's the study itself. The formal title is Evaluation of a Novel Drain Stripping Device for Reducing Surgical Drain Complications, approved under IRB number 24006697. Rob Hill is the principal investigator, and Michael Thorne is co-PI. The design is a prospective evaluation of the device on Francis 4C and Mary Bryce 7B, in adult surgical patients with intra-abdominal JP drains, compared against matched retrospective data from patients who received standard drain care. Target accrual is up to 650 subjects. Here is the most important thing to understand: the primary objective of this study is your feedback. We want to know whether the LAXO is easier to use, faster, and more effective than the way you strip drains today, and the only way to learn that is from the nurses using it. That feedback comes from a short, anonymous, completely voluntary survey. Secondary objectives look at patient-level outcomes: how long drains stay in, rates of occlusion, seroma, and hematoma, and whether patients need fewer drain-related procedures. Who's enrolled? Adults 18 and older who have a Jackson Pratt drain placed in the abdominal cavity during surgery, and who have provided informed consent. Consent is obtained by the surgical team before the surgery or procedure, and a family member may also provide consent on the patient's behalf. Excluded are pediatric patients, patients without JP drains or with drains outside the abdomen, anyone with an allergy or contraindication to the device materials, and patients for whom consent was not obtained from the patient or a family member. If you're ever unsure whether a patient is on study, check with your charge nurse or the study team. What does this mean for you, shift to shift? 4 things. First, complete this training before using the LAXO on a study patient. Second, for enrolled patients, use the device with the standardized technique whenever you strip their drain. Everything else about your drain care stays exactly the same. Third, give us your feedback. At the end of any shift where you use the device, complete the anonymous survey. It takes just a couple of minutes, and it is the primary data of this study. And fourth, speak up. If anything about the device seems off, tell your charge nurse super user or the study team right away. Now let's put it all together. On the left is the demonstration video, and the 4 steps are on the right so you can follow along. Before you start, always complete your standard drain care first. Assess the tubing for kinks or cracks, check the insertion site and securement suture, and empty and recompress the bulb. Then inspect the LAXO and clean it with an alcohol swab. Step 1. Secure the tubing. With your non-dominant hand, pinch the drain tubing about 1 cm from the insertion site, above the suture, and keep that hold through the entire process. Step 2. Position the device. With your dominant hand, close the LAXO around the drain about 1 cm above your fingers, with the tubing centered in the channel and the hinge parallel to the tubing. Step 3. Strip the drain. Compress fully, then glide the device down the tubing toward the bulb. Step 4. Repeat and verify. 2 to 3 passes, watching drainage flow freely into the collection bulb. Once you've finished stripping, for quick things, verify suction. The bulb should remain collapsed, holding constant negative pressure. Secure the bulb, pin it to the patient's clothing so there's no tension at the insertion site or on the suture. Clean the device with an alcohol swab and store it in the patient's room, it stays with that patient. And finish with hand hygiene. Remove your PPE and wash your hands. One more thing, when the patient is discharged, the device is disposed of in the dedicated disposal container. A quick review of the do's. Secure the drain tubing at the insertion site before every single stripping pass. Inspect the device and the tubing before each use. Clean the LAXO with an alcohol swab before and after use. Keep the device at the bedside for that patient only. Chart your standard drain care exactly as you always have: output, character, volume, and site assessment. And complete the anonymous survey at the end of shifts when you use the device. And the don'ts. Don't ever strip without securing the tubing, that's how drains get pulled out. Don't use one LAXO on more than one patient, it is single patient use only. Don't use it on damaged, cracked, or kinked tubing, or on rigid, non-JP tubing. Here's one that surprises people: don't chart use of the LAXO device by name in the patient's record. This protects the anonymity of nursing staff in the study. Chart your standard drain care as usual, just without naming the device. Don't force the device, compression should be firm but gentle. And don't troubleshoot alone, your charge nurse super users are trained on this device, and the study team is a message away. A word on safety. The risks in this study are the same ones that exist with standard drain stripping: possible drain dislodgement, infection, tissue irritation, or inadequate drainage. Based on laboratory testing, the LAXO does not add new risks beyond the current standard of care. If a device-related event occurs, report it through your normal unit process and notify the study team. For logistics, new devices are in the cabinet near the charge nurse station. Log your checkout on the tracking sheet. Used devices go in the dedicated disposal container. Each device has an ID sticker. And for anything else, ask a super user, or go to laxodevice.com. Everything for this study lives in one place, laxodevice.com. There you'll find the training video and materials, so you can rewatch the demonstration or review this presentation anytime. You'll find the nursing survey link, the anonymous, voluntary survey that is the heart of this study. The site also hosts the IRB documentation for the study, FAQs and troubleshooting tips for the device, an incident reporting form if something doesn't go as expected, and a support availability calendar showing when study staff are on site or reachable. Bookmark it, it's the fastest way to get an answer at 2 in the morning. The evidence base for this study spans decades of surgical drain research, from the value and risks of prophylactic drainage to validated tools for measuring surgical complications. A selection is shown here, and the full reference list is available in the study protocol, IRB number 24006697. One last step: make it official. Go to laxodevice.com and click Complete your training. Check off your name, or add yourself if you're not yet on the list. Your training isn't complete until your name is checked off. If you have questions along the way, the support staff page on the website shows the weekly schedule and contacts, or just ask a charge nurse super user. Thank you. Your hands, and your feedback, are what make this study possible. If you have questions about the device, ask any charge nurse super user. To reach the study team, email support@laxodevice.com, and you'll find every resource, including the survey, at laxodevice.com. We're grateful to have you as part of the LAXO study. Welcome, and thank you for taking a few minutes for this training. This module will introduce you to the LAXO device and how we'll be using it in clinical practice here on Francis 4C and Mary Bryce 7B. The LAXO study is led by Rob Hill and Michael Thorne, both nurse practitioners here at Mayo Clinic. As a bedside nurse, you are at the center of this study, and this presentation will cover everything you need to know. Let's start with the why. Jackson Pratt drains do important work after surgery. They remove fluid that would otherwise collect and cause problems. But when drain tubing clogs, drainage fails. That can mean seromas, hematomas, infection,